Today we're going to review a post-op total knee packet. So here we're going to review the risk first. So the risks are going to be blood clots. So we're going to have you take an 81 milligram baby aspirin twice a day for 30 days following your surgery. You'll also get sent some compression devices. Those compression devices will squeeze your calves when you're laying down and resting and help prevent against blood clots. We have you wear those plasma flow compression devices for about 2 to 4 weeks after surgery when you're laying down and resting for long periods of time. You can have some numbness and tingling around the knee after surgery. That is normal. That should resolve over time, but you may always have some numbness near your incision site, which is also normal. You can have a risk of intraoperative fracture. If that happened, we would address it at that time, but it is a less than 1% risk. Risk of dislocation, we tell you to be careful kneeling down on that knee and avoid kneeling down on that kneecap. And the big one is risk of infection. If this gets infected, it's a big deal. You have to go back to surgery, wash it all out, sometimes redo the whole surgery. It's not something that you want to have to do. So we ask you a couple of things. Number one, don't soak your incision for 6 weeks. You can shower, just not submerge into water for 6 weeks. No lakes, pools, hot tubs, or baths for 6 weeks at least. The other thing is any time that you have a dental cleaning or dental procedure, we want you to take antibiotics ahead of time. This also includes things like colonoscopies or procedures deep into the skin. Reason for that, if bacteria gets into your bloodstream, the first place it's going to want to go is that joint. So we have you take an antibiotic ahead of time, only about 30 minutes before the procedure, and you take another dose about 6 hours later. How that works is you call us and we'll send that into your pharmacy so you can have that prior to your procedure. Next we'll review medications. These medications here will be sent to your pharmacy when you leave the hospital, but we'll review them now. So we use a multimodal pain approach. We approach pain from multiple different aspects. So we give you meloxicam, Tylenol, gabapentin, which works on nerve pain, a muscle relaxant, and a stool softener. We have you take those for at least the first 72 hours, then after that you can just take them as needed. If you need them for longer than that, then that's fine. You can just take which ones you need at that point. There are 2 medications we do want you to take for 30 days following your surgery. One is omeprazole or Prilosec. That protects your stomach from GI ulcers when taking multiple anti-inflammatories. The other one is aspirin. That's a blood clot medication that you'll take for 30 days following your surgery to help prevent against blood clots. We will give you a script for narcotic, oxycodone. We say save that for breakthrough pain. We want your first-line pain medications to be these listed over here, but if you're still having pain after taking some of these, you can reach for one of those, but again, many of our patients don't need too many of them at all. And something for nausea in case you get nauseous as well. Post-op instructions is what we'll review next. So you want to avoid extreme positions if painful. You can put as much weight on that knee as you want to after surgery. You'll be up and walking on it on the same day. The hospital will give you a walker in case you need a walker for stability, but otherwise you can put as much weight on that knee as you want to. You will receive an ice machine today at your visit. We want you to use this ice machine as much as you can tolerate. This will be very important for your recovery. In a knee replacement, you have 2 main goals. Your first goal is to make sure you keep that knee nice and straight when recovering. What does that mean? That means when you're laying down that you have something behind the back of your Achilles tendon, nothing behind the back of the knee, keeping that knee nice and straight. And we'll demonstrate this for you in the hospital. If you recover with your knee bent and constantly have it bent, it'll get stuck like that. So important to know that you always have something behind the back of the ankle, nothing behind the back of the knee. The other goal is to make sure you get the swelling down, and we use the mnemonic RICE: rest, ice, compression, and elevation. So you want to rest for the first couple days. Make sure you have this ice machine on your knee at all times with the ice fluctuating through the back of the knee, compressing the knee with an ACE wrap, and elevating that leg above your heart. So what that looks like is having your ankle above your heart. That will help you get the swelling down. You'll have an incision. Over that incision will be a bandage, and that bandage will stay on for 7 days. It's an important number to remember, 1 week. After 7 days, that bandage will be removed. Then you can let soap and water run directly over the incision site. You'll pat it dry when you get out of the shower and cover it with a clean, fresh bandage. The next time you go to shower, you'll remove that clean, fresh bandage, let soap and water run again over the incision site, pat it dry, and cover it with a new clean, fresh bandage. You want to repeat that process from then on. The first week it's going to be covered in the shower with your surgical bandage. The second week it'll be uncovered in the shower, although a clean, fresh bandage will be put on once you get out of the shower. We will give you home health. Home health physical therapists will come to your house. They will also have a nurse that can provide you with some bandages to cover the incision with once you get out of the shower. In terms of driving, we say at least 2 weeks until you can drive. But again, that's your decision when you feel comfortable to drive. You cannot be on narcotic pain medications, and you want to evaluate that your reaction time is normal. This here is some post-operative exercises that you can do on your own when the therapist is not there, although the therapist should be coming to your house within 3 to 5 days after your surgery. There is also a therapy guideline packet that they can follow. It's called this exercise program packet. You will have 3 weeks of home health physical therapy, and then we will send you to an outpatient physical therapy where they can follow these guidelines exactly. Check-in time for your surgery is going to be listed here. So your surgery date will be listed here, but check-in time will be given to you by the hospital the day before surgery or the business day prior to your surgery. A couple things you want to do before you have your surgery scheduled is make sure you have these things done, is scheduling a 2 and 6 week post-op appointment. So that way after your surgery you already have your post-op appointment scheduled. At 2 weeks will be a quick wound check, and at 6 weeks we'll do more of an exam at that point. You need to have medical clearance done by the hospital. You'll go over to the hospital and make sure you have lab work, chest x-ray, EKG done to make sure you're fit to go under anesthesia. At that same time, you will partake in the joint class, where they will give you some wipes to wipe down your leg the night before and the morning of, give you some nasal swabs to clean your nose with and decrease risk of infection, as well as give you some protein drinks to help increase your protein levels for recovery. We also want you to drink a 12-ounce Gatorade 3 hours before your surgery, any color but red, to help decrease postoperative nausea and increase bowel motility. The other thing you need to do if you're having a Mako knee is get a Mako CT. That's also done at the hospital. So you can do the clearance, the joint class, and get the Mako CT at that time. Medications, we do want you to stop some medications prior to surgery. Common ones are anti-inflammatories and medications that thin your blood, such as aspirin or fish oils. But we'll have the hospitalist and us as well review your medication list and let you know which other medications to stop, typically within a 7-day window. Important to read on this list other things you can do prior to surgery, such as don't eat anything after midnight. And to surgery, you want to make sure that you bring your surgical packet, any DME equipment that you have, which should be your ice machine, and then again, the walker will be given to you when you get to the hospital. If you have any questions, you can call our office at 972-250-5700 and ask for Dr. Evanson's team, and we'll be happy to answer those for you.